Assalamu alaikum again. This is second presentation for the pre-course lecture for advanced endoscopic skull base that going to take place in the 1st and 2nd of February. We're going to continue in the anatomy for these important approaches. We're going to talk here in the basic anatomy of the nasal cavity, and this presentation is really meant to be for neurosurgeon resident, as the ENT resident and ENT surgeon really does not need much orientation, as this is their domain. This is a lateral wall of the nasal cavity that we're often posing cadaveric image into the MRI sagittal view to orient us about what we're really talking about. So we're starting with the lateral wall of the nose. The nasal cavity starts from the vestibule, which is surrounded, or the opening, external opening of the nasal tract, which is surrounded by cartilage, as we're going to see later. The back opening of the nose is the nasopharynx, or the opening of the nasopharynx, or the choana. This is important basics, of course, to understand the boundaries of the nasal cavity, which is surrounded by bone and cartilage. The anterior superior bone is the nasal bone, and also superiorly, anteriorly is the frontal bone, which contribute through the glabella, which is a communication between the two supraorbital ridge, or superciliary arches externally, but also contribute to the frontal sinus, which is an important landmark for nasal anatomy when we talk about this procedure. Ethmoid bone will make and contribute through a cribriform plate superiorly, and the midline, as we're going to see later, through the perpendicular plate, and laterally is the superior middle turbinate, as well as the ethmoidal sinuses. Sphenoid bone contribute superiorly and posteriorly through the planum sphenoidale, tuberculum, sphenoid sinus, sella, and dorsum sella, which with the occipital contribution will make the clyphus posteriorly. In the nasopharynx, you have the C1, C2 contribution. We'll talk about that anatomy later, as it's very important, but it's really not part of the nasal cavity per se. The floor of the nose is made up of palatine bone, as well as the maxillary bone. Now, in the midline, as we said earlier, is the perpendicular plate, and the former superiorly perpendicular plate, and inferiorly is the former. We're going to talk about that later. The lateral wall main feature is the concha, or the turbinates. You have superior, middle, and inferior turbinate. Superior middle turbinate is part of the ethmoid bone, where inferior turbinate is part of the palatine bone. And deep lateral to the turbinate, you have meatus, or spaces, and that is correspond to each one by its name. So superior turbinate has superior meatus, inferior turbinate has inferior meatus, and middle turbinate has middle meatus. And that anatomy is important, and you're going to see later why. You have paranasal sinuses, of course, frontal sinus, sphenoid sinus in the back, and laterally is the ethmoid sinuses, inferior lateral, and inferior to the orbit is the maxillary sinuses. In the nasopharynx, we have important structure that we need to be familiarized with: the eustachian tube, the tonsil of the pharynx, as well as the fossa rhizomolar. I'm going to show here a few of endoscopic picture. To the left nasopharynx, as you can see, the opening of the eustachian tube, or auditory tube, which is ostium pharyngeum, and you have an elevation above that is turris tuberous, which is a reflection of the cartilage of the eustachian tube. Anterior and posteriorly, you have sublinguopharyngeal fold, which is reflective of muscle or muscular attachment of the eustachian tube. And deep in the back of the anterior fold is the fossa of Rhizomalar, which is an important landmark to approach the ventral skull base when we are trying to take a lesion that is far medially or lateral to the nasal cavity. The medial wall of the nasal cavity, as we mentioned earlier, is made up of two bone and cartilage. The peripendicular plate of the ethmoid bone will make the posterior superior part, and inferiorly is the femur. Both will communicate with and articulate with the sphenoid sinus, in particular the rostrum in the midline of the sphenoid sinus, and the femur will articulate with the palatine bone and the maxillary bone in the floor of the nasal cavity. Anteriorly, you have cartilage that it should be safe during as much as you can during transnasal approach to prevent comorbidities, where prependicular femur can be partially removed. The blood supply is a little complex, but there are really five arteries contribute to the blood supply of the nose. This is the medial wall of the nose, which is a little different than the lateral uh, part of the nose in terms of blood supply, but mostly you have and mainly you have blood supply from anterior and posterior ethmoidal artery. Occasionally you have middle ethmoidal artery, and these arteries originate from ophthalmic artery of the internal carotid artery, and then you have uh, sphenopalatine artery and greater palatine artery, which are a contribution of the internal maxillary artery. And finally, you have superior labial artery, which is a contribution of the facial artery. The last three is external carotid artery origin. And you have anastomosis in the front. This is CTA, fine cut to show the blood supply and image-wise to the nose. The olfactory system or olfaction fibers are located in the superior one-third of the septum medially, and also in the superior, most superior turbinate and part of the middle turbinate as well. So that need to be safe. If you take the cribriform plate, you're taking the olfaction system. The other sensory modalities carried by the trigeminal nerve, as you can see, through V1, sorry, V2 mostly, but some V1 of the trigeminal division going to carry all of that sensory in terms of temperature, touch, and pain. We're going to conclude here, and thank you very much. We'll talk later about the sustain surrounding the nasal cavity, which is important for skull base surgeon. Thank you.